Hello, I'm Rose Lewis, Senior Director of Marketing and Communications at Beth Israel Deaconess Hospital in Needham. Behind me you'll see there's a lot of exciting activity going on as we are a few months into the building of the Beth Israel Deaconess Cancer Center and Surgical Pavilion. And joining me today to talk about this is our new Medical Director of the Cancer Center, Dr. Rob Friedman, and the President and CEO of Beth Israel Deaconess Hospital Needham, John Fogarty. Hi, thanks for coming by.
Morning.
Taking time out of your busy day. It's really very exciting to talk with you about the Cancer Center and Surgical Pavilion, but I must tell you, what is so much fun is to watch the changes day after day after day. Patients, friends, family. I mean, there's even a woman on the sidewalk with her baby and they're watching the construction, and there's nothing more fun than watching the young children, watching all of the bulldozers and the cement mixers come through here. But before we go any further, I really do want to let people know exactly what will be in the building. First of all, this comprehensive center will be attached to the hospital, allowing people to move seamlessly between the two buildings. It will be a 3-story, 30,000 square foot building that will significantly expand and improve cancer and surgical services available to the community. Slated to open in the fall of 2014, and a $6 million capital campaign is now underway to support this building. In addition to the Cancer Center, of course, as we've talked about, is the Surgical Pavilion. BID Needham has seen a 12% increase in surgery volume over the past few years, and adding 2 state-of-the-art operating rooms and a new recovery room is going to allow us to go from 2,500 to 5,000 surgeries annually within a 5-year time frame. So really, this is something that the community needs, the hospital needs, and it will enable people to go get their health care closer to home. John, you've been instrumental in launching this project, but it's really more than just constructing a building. It's really building relationships and a true collaboration with the medical center. How did that come about?
So the creation of the Cancer Center and the Surgical Pavilion was really an intersection of opportunity between the medical center and Needham, in that the medical center needed to develop cancer services that were more accessible to the community. They had previously had a center that was in the Waltham area that they had to relocate out of. Simultaneously, Needham had a growing oncology program here at the hospital, and we needed to develop expanded surgical capacity because we had been growing in our surgery program for the last 1 or 2 years. So it came together nicely in terms of a good collaboration and an opportunity where both parties had something to gain and meet a growing community need.
That's great. Dr. Friedman, you're new here. You're here just about a month. You came in at the very end of August, and you came from Harvard Vanguard, where you were Chief of Oncology, Hematology. And tell us what you see about this project so far.
My time here so far has just been fantastic. The Needham community is so supportive, and all of the staff here at the hospital have been really very accommodating and helpful, and I'm really looking forward to being the medical director of the Cancer Center. A lot of great work has been done already in terms of the layout and the plans. Since I've been here, we have been busy trying to figure out an operational plan, how we're going to staff it. That part has been really exciting to get involved with.
Yeah, that's great. Now, for both of you, I know you know this, and John in particular, you were very involved in this, in the planning of this. It's been really an interesting process in that staff, physicians, nurses, and patients even were very involved in the planning stage of this. This hasn't just gone up with architects. Everybody who maybe has a place in this building and who's going to be involved in working here has made this a very patient-centered building. Can you talk a little bit about that?
So at the outset of the planning, there is a management method known as lean methodology. And lean really is a practice whereby you eliminate unnecessary steps in a process and eliminate waste, and it makes it better for patient care, and it makes it more efficient delivery. And we utilize lean methodology in designing the facility. So what you do in that process is that you involve the people who will actually work in the facility in its design. So as you indicated, Rose, both the surgical facility and the cancer facility were designed based, the philosophy we used was designed by patients for patients. So we asked through focus groups cancer patients and surgery patients who had had an experience either in our system or elsewhere, what did you like about it, what didn't you like about it? And then we convened the staff who work in the facility to determine how we can meet that need. So it was designed really to be patient-centric. We spent days off-site in a retreat where we laid out different models of how the facility could work, minimizing patient inconvenience, the amount of time that a patient would have to travel from one end of the facility to another, and it really affected the design. So I think we ended up with something that is unique, will be unique for patients, and was a great experience for the staff to design, and I think will be a great facility that they're excited to work in.
Dr. Friedman, you already have a wonderfully talented group of physicians and nurses who are going to be working with you here. Can you tell me a little bit about them?
With me in medical oncology is Dr. Mark Huberman, who is a nationally known lung cancer expert who's been in practice for quite some time, and he's with us a few days a week. Dr. Stuart Berman from radiation oncology is also an expert in the thoracic malignancies and the radiotherapy for the treatment thereof, and he's very experienced and seasoned. Dr. Mary Jane Houlihan from breast surgery and Dr. Deborah Nagel from colorectal surgery already have established clinics here at Needham, and together we are going to be forming multidisciplinary teams that will facilitate the best care of the patient. I mean, our vision here is to provide cutting-edge tertiary care, teaching hospital support here in the community. And I think the real power of the tertiary care medical center is leveraging that multidisciplinary aspect, where you got all your doctors communicating and coordinating the best care for people with cancer. And for many patients, going downtown to do that is really hard. And not only that, sometimes there can be delays. What we really think we're going to be able to do here is provide that multidisciplinary care right away in order to best take care of the patients who have been recently diagnosed with cancer.
And I'm going to get a little more practical now. My understanding is sometimes there are people who have to go for weeks for radiation, and it can take them longer to park than to actually get the treatment. And that, I think, will be alleviated here as well.
That is so true. And one reality that patients don't necessarily appreciate at the time of their diagnosis is that radiation is the same whether you get it downtown or whether you get it here. It's the same amount of radiation. And what will happen is if somebody needs radiation, the patient will have the planning for the radiotherapy at the medical center. That's a very sophisticated process involving specialists and physicists and whatnot. But the treatment plan can be carried out here at Needham. And oftentimes radiation therapy is 10 or 15 minutes per day, but you might need to do that 3 to 6 weeks. So instead of spending an hour driving to and from your radiation appointment to get 15 minutes of radiation, patients who live locally here will be able to drive right in, get their radiation, and then move on with their day without having to spend hours commuting.
Yeah, that's a great advantage. John, tell me a little bit about the surgical pavilion. I know we're going to be adding 2 more, you'd call state-of-the-art ORs and a new PACU. Tell me a little bit about what's that going to enable the hospital to do.
So a couple of things I'd like to point out with regard to that aspect. First, I would like to echo Dr. Friedman's comments in the sense that what will really be unique about the Cancer Center will be that you will have the world-class specialists that he's referred to here in the community. So we're in football season, so using the Patriots analogy, you'll have world-class players on the team with Rob really as sort of the coach, quarterback, bringing that together, interrelating with the primary care doctors for the care of their patients and really delivering a great service. As I said earlier, our surgery program was growing exponentially prior to the onset of this project. We expect it to continue to grow, particularly given the fact that we are developing a cancer center here. So there are a number of oncological surgery subspecialties that will really grow here as a result of having a world-class cancer center. Breast surgery, colorectal surgery, lung surgery, and things of that nature. As Rob indicated, those specialists are already starting here now in advance of the Cancer Center actually opening. So that will really bring not just our cancer program, but our surgical service to a whole new level. I think it's really important to stress that we'll have a world-class cancer program and a world-class surgery program, but based in the community, where it is accessible to people in these western suburbs, easily usable for their primary care doctors. So really you're getting the best of all worlds with this center being developed.
And if for some reason it's something that, for whatever, can't be done here, you have a direct link to Beth Israel Deaconess Medical Center, which makes it nice for patients.
So that's a very important point. There are across the country freestanding surgery centers and cancer centers that have been developed in Massachusetts and elsewhere. One of the things that will be different about this is that we are an affiliate of the Beth Israel Deaconess Medical Center. So the care will be seamless in the same way that much of what we do here is seamless with the medical center. So yes, access to services downtown, communication between Needham and the medical center, whether that is professional communication, information technology, access to tertiary services, very seamless. So that should really bring some benefits to this center that you may not see in other centers in Massachusetts or throughout the country.
Well, I mean already, because we have an emergency department which is a direct link to downtown, and so many other departments here now, which was to back up a little bit. So this is really phase 2 of a 2-phase process. The first phase of the expansion really being opened in 2009 with the new inpatient unit and the new emergency department.
Yes.
And those have grown as well.
Yes, so with the opening of the emergency department in Needham in 2009 really was a turning point for the hospital. It allowed the community better access to the hospital. The emergency services, the physician services are provided by Beth Israel Deaconess Medical Center, emergency physicians, again strengthening that connection to downtown. That really made the hospital a busier place and more of a presence in the community. The Cancer Center and Surgical Pavilion really builds on that foundation to take not just the hospital, but the care that we're providing to the community to that whole next level.
And Dr. Friedman, you've been here not too long, but you can already see the growth, and I hope you've seen the support of this community, because just within the past few years, and particularly with this project, I feel like the community has really rallied and is really excited about this. Have you felt that?
Absolutely. I think it's really incredible. One of the things I first noticed when John was taking me around the hospital was the purple army. All the volunteers wearing their the purple uniforms, and how helpful everyone was. Clearly, I must have looked lost, because everyone kept on asking me, like, "Do you know where to go? Who are you looking for? one volunteer walked me all around the hospital to find your office. Yeah. And you know, just from all of the meetings we've had so far, and also meeting with people here in the community who are helping to support the Cancer Center, the enthusiasm is so remarkable, especially compared to other communities I've been in. I think it's really going to be an important part of the Cancer Center. I'm really excited to see what develops in terms of people here in the community helping the patients here at the Cancer Center.
John, you've been quite involved with the community as well. What's your sense of what people are seeing as they're watching this incredible building going up?
Well, I think Rob hit the nail on the head. I've been in healthcare management for about 25 years now, and I have to say this is the third or fourth hospital that I've been involved with, and the second hospital where I've been the chief executive. I've never seen community support of a hospital like we have here in Needham, and it's certainly the volunteers, it's the board of trustees, it's the donors in the community, the people who work here at the hospital who are from the community. It's really a very unique place. Part of the work for this project is reaching out to the community to support the project. So we're in the midst of a $6 million capital campaign to build the Cancer Center and Surgical Pavilion. And while there's some heavy lifting with that, one of the benefits that I've seen of it is that I'm spending a lot of time out in the community with leaders of other organizations, with community donors, or just with connections in the community who are interested in the hospital. And it's rare that you feel or see as much of a sense of pride that a community has in their community hospital as you see in Needham. Many communities take their hospitals for granted. Some of them actually see their hospital at times as somewhat of a nuisance. You have ambulances and noise and traffic. That really isn't the case here in Needham. So we're very enthusiastic about the support we've had. We're almost halfway through our campaign in terms of our goal. And we're excited about the support we've received so far.
Yeah, it really has been remarkable, and I think one of the reasons is that it did start off as a very small hospital. People were born here, people have been treated here, their parents or themselves, and I think as they see it grow, they appreciate the fact that everybody is coming out here from the medical center. Everybody wants to be a part of this, so it's really an interesting phenomenon.
Well, I think I'd also add that it's in line with the direction of the way healthcare is provided. Now, there are certain services that the community should be going to Boston or to academic medical centers for because those are the best places to go for them. There are other services that if you live in Needham, Dover, Westwood, Newton, that should be accessed in the community. They're easier to get to. They're often less costly. And that in this crazy world of healthcare reform, we're seeing that's become more of a focus, that patients want to access services more closely to home in the least costly, most accessible format.
Yeah. So another practical aspect of this is parking, which I think in Needham and really everywhere I go, whether it's a hospital or another building, parking always comes up. And so I just wanted to let people know that there is going to be plenty of parking for this new comprehensive center. And I think that's important to note because I think it's something that, as we pointed out earlier, makes it easier for people to get their care, and it's free.
No question. Having practiced downtown for the past 4 years, I can tell you that the number one complaint from my patients is parking, followed closely by the amount of time it took them to get to their appointment. Yeah. And it is, there are a lot of costs and difficulties in the treatment of cancer, no question. Somehow, having to spend somewhere, depending on coverage of the appointment, somewhere between $5 and $40 for parking. Yeah. Again and again and again, several times a week sometimes, depending on what you're getting. It is a real burden on patients, and not to mention the time going back and forth to 45 to 60 minutes sometimes for a 5 or 6 mile trip.
Well, and the friends or relatives who are helping out, I think having something in the community where family and friends live is going to make it easier, not just for the patient, but for everybody involved in that patient's care.
Yeah, it was such a relief to see that parking had been planned for in this cancer center when I came on board. It was also coming from a hospital where I used to work, where a large cancer center was built. There wasn't much parking put in place for there, and knowing what a problem that was.
So tell me, Dr. Friedman, a little bit more about your vision for this new center.
One thing we want to make sure is that with all of this cutting-edge multidisciplinary care, that the cancer center is going to be a really comfortable place for patients to get their care. I want everyone in the community to know that that the cancer center is going to be accessible, and that the staff are going to be happy and warm. They're going to love working here. And I think that really translates into just it being a great place for people to receive care for their cancer. The Beth Israel Deaconess Medical Center is really very active in conjunction with the Dana-Farber Harvard Cancer Center and offering the latest and best therapies for patients who are newly diagnosed with cancer. The Beth Israel in particular is a leader in immunotherapy. I think we're going to be seeing in the future more cancer vaccines and using the immune system to help fight cancer. And we're going to be able to provide access to the latest and greatest right here in the community without having to go downtown.
Yeah, that's great. That's great. So when can we expect this to open, John?
So we're in the midst of a lot of banging and shoveling right now. We broke ground on the facility in April of this year, 2013. Our expectation is that the building will be closed in and weather tight by the end of this calendar year in 2013. And we expect completion sometime in the month of June 2014. So opening day probably sometime between the middle of the summer and very early fall of 2014, and we're very excited to bring this program forward.
And I'm sure we'll have a wonderful grand opening as we did in 2009. I think we had almost 1,000 people come through, and it was really a wonderful day for the hospital and for the community. Well, thank you both for coming out on this warm day to tell us more about the Cancer Center and the Surgical Pavilion. And I know I'm looking forward to it progressing back here and for the opening sometime next fall. Thank you.
Thank you.
Thanks for having us.
This really completes the facility footprint for our campus. This 30,000 square foot structure will include 2 floors, a comprehensive cancer center, as well as a brand new surgical pavilion that will complement our fast growing surgical program here at the hospital. By signing your name, in addition to making your mark, we feel that it really makes you part of the facility. It really gives your permanent mark on the hospital and is there to commemorate your role in this important structure for years and years to come. To me, your name, all of our names, represent a group of people who really have come together to make a very unique facility and represent commitment, the hospital's commitment to our friends, our families, our colleagues, for a healthier community and to bring a great scope of service to Needham and the surrounding towns and areas. Everybody's name represents an individual story, why you chose this hospital as your hospital, why you chose to work at this hospital, why you chose to support this hospital. All of that gives great meaning to what we're doing.
It's just such an exciting time for the hospital to have a community support us and to be able to have cancer care right in the center of Needham. Rather than having to go downtown and struggle with traffic, we're really happy to be able to provide excellent cancer care in our neighborhood. The entire community has been incredibly supportive, and we, from the selectmen to all of the elected representatives in the state, as well as all of the people in the town of Needham, have supported the hospital in many different ways, not just financially, but in coming here and in volunteering, and we're really fortunate to have such a dedicated community at the hospital. So many people have been touched by cancer, and unfortunately we will see people in the community who are coming here to receive cancer care or to have surgery. But at the same time, we hope that the hospital will be a gathering place for the community, and that people will feel that it's their place to come where they can get information on maintaining their health and where they feel they can get medical support that they need, not just in the moment, but really going out into the future.